All right, so today we will be discussing syphilis. Who is affected by it, what the symptoms are, how to get tested, and what treatments are available. So the first thing to understand about who is impacted by syphilis is that we've had a 33% increase in overall positive cases in Minnesota as well as the United States overall in the last 3 years. A large part of the issue is that there is a barrier to testing in the United States since not everyone has access to health insurance, and some insurances do not cover the office visit, testing, or treatment options that are currently available. Among those who have tested positive, the vast majority over the last several years have been men, particularly men who have sex with men. Women and men are both affected by syphilis. Both men and women can be infected by syphilis and can transfer that disease onto somebody else. However, currently what we are seeing is the vast majority of positive cases are men. So what are the symptoms of syphilis? Syphilis happens in several stages. The first stage of syphilis is going to simply be a painless sore that will occur in the genital, mouth, or anal region, as well as a headache. Now, a headache can be attributed to many things. However, a sore is not something that's going to be a common occurrence. It's easy to ignore it possibly, however, because it's not going to be painful. And it might be easy to think it could have just been from an accident you don't remember occurring. So it's not always caught in this stage. The second stage of syphilis is when the sore will go away. However, a rash on the hands and feet will appear, as well as people usually will begin to experience things like weight loss, hair loss, as well as a fever, because syphilis is a bacterial infection which causes a fever. Now, after the second stage is something called the latent stage. In that stage, all symptoms go away. You no longer feel ill, you no longer have any sores or rashes, and there's no indication of any infection at that stage. However, after that stage, which can last for several months, is the third stage. In the United States today, very few people reach the third stage. It's usually caught before that. However, if someone does not receive treatment prior to the third stage, then what can happen are psychotic disorders, internal bleeding, damage to internal organs, as well as respiratory failure. And it's important to note that any organ damage that occurs in this third stage, even if you receive treatment at that point, is going to be permanent damage. It is not reversible. So where can someone get tested? Well, if you have insurance, the easiest thing will be just to go to your doctor at the clinic you normally go to and ask for an STD panel, which would be so that you can be tested for a wide range, including syphilis. Now, if you do not have health insurance, or if you're underinsured, meaning you have insurance that does not cover this option for testing or treatment, Planned Parenthood as well as the Minnesota Health Department both offer free testing and free treatment options for those who need those services. Syphilis is treatable. Now, not all STDs are treatable. However, syphilis is one that is because it is a bacterial infection. If it is treated in stages 1 or 2, all that is required is one injection of benzathine penicillin G. But if it is not caught in the first 2 stages, then in the latent or stage 3 period, it can still be treated. However, it's more difficult. It's going to require 3 injections, 1 week apart of benzathine penicillin G. So you'll have one injection, wait 7 days, another injection, wait 7 days, so on and so forth. And the treatment plan's going to vary more with the stage 3 symptoms because more injections simply may be necessary to treat it at that point, depending on the severity of the infection. So I'll share with you a story of a young man named Jared who was attending college, and he began to experience some symptoms such as a painless sore. Now, he found this to be very easy to ignore, so he chose not to go to the doctor. Being in college, not having insurance, and paying an expensive amount of money to tuition, he didn't want to have another expense. And a medical expense, that can be significant in the United States. So he ignored it, and it went away. So he thought, well, it was nothing, I'm fine. However, at that point, he developed a rash. He started losing his hair, started losing weight. Hair loss, weight loss can easily be attributed to perhaps something else, even stress, being in school. However, the rash on the hands and feet is difficult to ignore. So he started to try to figure out where he could go to be tested because he didn't have health insurance. And so, searching online, he found the Minnesota Health Department does have free testing available. And so, he made an appointment, went in and had a test, and found he was positive for syphilis, at which point the doctor explained that the Minnesota Health Department also provides free treatment options for those who are uninsured. So he was able to get treatment as well. And so from this, he learned about the available resources in his area and how he could help others learn about those resources, as well as not everyone is aware that Planned Parenthood and Minnesota Health Department offer free testing and treatment for those who need those services. So how can syphilis be prevented? Because that's an important question. The first and easiest method is going to be condoms. Pretty much available everywhere, easy to use, easiest way to prevent transmission of any STD, including syphilis. Another excellent option, is long-term mutually monogamous partners. The fewer sexual partners you have simply decreases the chances of in contracting STDs, including syphilis. And simply get tested. If you're having symptoms, if you're having an unusual rash, go to your doctor if you're able to. And if you're not able to go to your regular doctor, check out Minnesota Health Department, see what services are available to you that might be able to help you find out if you need care for something. So if you are having more questions, then go to the Minnesota Health Department website. There you can look at locations for testing. You can make appointments. You can find out what other options are available for treatment as well as prevention.